Scientists here are hoping to unleash the power of the salmonella bug. They believe the bacteria could be engineered to create an effective treatment to fight bowel cancer, one of the most common causes of death in this country. Well, Dr. Kendle Maslowski from the University of Glasgow's Cancer Research UK Scotland Institute has been leading the research. Good morning to you, Dr. Maslowski.
Good morning.
Just tell us a little bit then about how salmonella could help in the fight against bowel cancer.
Right. So cancer is a really complex and devious disease, as we all know. But so are pathogens such as salmonella. And I've long had an interest in how bacteria interact with our bodies. So we use salmonella that we make safe by engineering it, taking out essential genetic elements. And we study how they kill cancer. So we know that they really like to live within cancer cells, or within cancer masses, rather. And one way that they kill cancers is that they're even more fast-growing than cancer itself and are extremely greedy and kind of consume a lot of the nutrients, out-competing our tumours. But another way they do this is that they alert our immune system to the presence of the cancer, and they kind of enable immune cells to come in and do the job of killing off the cancer cells.
So what, your immune system goes, oh, there's the salmonella bug, we don't like that, we better go there, and then actually, so that alerts it, and the immune system can attack the cancer at the same time.
Exactly. So as some kind of bilateral damage, we get then tumour killing. And so one of the problems we've known for a good 20 years in the field is that a part of our immune system, the T cells, which form this kind of memory that can then go and remember cancer that might come up years later, that these T cells are actually suppressed by the salmonella treatment. So this isn't great. So this particular piece of work, we've been finding out why that is. So we've been able to find out the mechanism for that and then further engineer the salmonella so that it doesn't disable the T cells anymore. And now we have T cells able to be activated.
Wow, so the salmonella itself is not dangerous because you've modified it. You've also modified it so it doesn't attack the T cells. It's alerting the T cells to the fact that there's a tumour there, and it's also eating the tumour or living within the mass of the tumour. I'm breaking it down to very basics here, I know.
Yes, yeah.
So it's working in sort of 4 or 5 different ways.
Yes, yeah, and this, I guess this is why it's a really exciting type of treatment. However, it's really complex. So kind of the more we dig out, the more we need to understand. So if we can at least engineer it to kind of take away some of these aspects that aren't so great, then we hope to generate a kind of engineered package, if you like, that is best able to kill tumours on all fronts.
And why is it so important that you're working on this in relation to bowel cancer? It's a tricky cancer to treat, isn't it?
It is. So treatments for bowel cancer haven't really changed much over the years, as we've seen for other types of cancers. Still rely on surgery and chemotherapy, and immune therapies that we hear a lot about today just really don't work in the majority of bowel cancer patients, because these types of cancers actually actively exclude our immune system. So this is actually a way that we can wake up the immune system to come into the tumours, and then potentially we can work alongside other types of immune therapies to make it even better.
And given that bowel cancer kills, I think, the most people, the most Scots, apart from lung cancer, there'll be a lot of people listening with interest to this. What's your timescale for your research and how you take it forward?
Well, we're still doing a lot of preclinical studies, but as we make great advancements like these, I'm looking towards setting up, kind of view towards clinical trials and kind of getting engagement with clinicians, and of course bringing on funding to enable trials. So, but we're probably, looking at 5-10 years sort of thing until we're actively trying this in patients. However, some of our findings kind of underline some basic fundamentals of how our T cells work. So this can also help instruct how we use checkpoint therapies. So I guess we'll just be working hard to kind of get this work out there and do more to further therapies on different fronts.
And it's interesting that it's sort of, I suppose, taken this long in terms of using the salmonella, because bacterial cancer therapy has been around for quite some time, hasn't it?
It has. So it was first kind of pioneered back in the late 1800s. At that time, we couldn't engineer bacteria, so it wasn't so safe. We do have one bacterial cancer therapy in the clinic. That's BCG. It's a vaccine for tuberculosis, is used for bladder cancer. So there is scope and interest, and of course, we use probiotics and all this for the gut. So we may well be able to double down and put in efforts to get this in clinical use.
Lots of area. It's an area where there's lots of big strides being taken at the moment. Thank you so much for explaining all of that, Dr. Kendle Maslowski there, who's with Cancer Research UK Scotland Institute at the University of Glasgow.
It's always fascinating to peek inside the laboratory, as it were, and hear these stories, because I think it gives people hope as well about what the future might hold.
And especially whenever a scientist who knows the real ins and outs of it can explain it to me. That's what I like as well.
Yeah. If Laura understands, then it's been explained
well.
Oh, I'm not arguing.
There's a reason I'm here. If they can make me understand, then our listeners are all good.
It's 20 past